My name is Daniel Baum. I've been in Israel for, I guess, 27, 28 years. I'm a social worker, clinical social worker, and I'm also married to a social worker, so there are two social workers. So I understand that. My wife works with in Khalit with Bikur Bayit. These are people who have chronic diseases and Alzheimer's and so on and so forth. I have over 36 years of experience in addictions, both in the United States and here. I worked for a few years in Shavut Bet HaSohar, the prison service, when they opened up their first and probably the largest, I don't think it exists anywhere in Israel, where the whole prison was dedicated to the treatment of addictions in Kedah Sharon, and then they moved someplace else. I worked in Ishpuzim. I worked in a methadone clinic as well. And my last job...
The one in Tapio, methadone?
In Jaffa. And then my last job was with Amutat Efshal, where the Amutat works, and it's been around for a while, works with alcohol, in the area of alcohol and gambling addiction. And then when they switched over to a private service, because the government wasn't paying for it anymore, they let me go. But that's cool, because now I have my own private practice. I work in the central part of the country. I have an office in Rishon LeZion, in Ranana, in Kochav Yirtzeh Gal, and so it's been interesting. It's been fun, and this is one of the reasons why it's fun. I get to do this. So I also taught when I was in the United States in the college. So I really enjoy this, and I'm really glad. Thank you for inviting me. Though I'll be presenting information to you during this lecture, I like this to be an interactive process. So please feel free to. And besides this, I love work sites that work out of houses and buildings and stuff like that. I just think it's so cool. I've always, Amutat Efshal worked out of a sort of a what do you call it? They at the beginning worked out of a house, and they worked. So I kind of like this sort of family-ish kind of thing. So it's really good. So I please feel free to sort of chime in and ask questions. The goals of my lecture is, first of all, to review what we know about addiction, and there are some little extra things that have changed a little bit. And as it relates to the addict and his family, and Nina asked me to talk about certain areas, and I'll do that. I want to add to your knowledge about addictions, the addiction process. I want to discuss some strategies on how to help the family heal. And in general, I want you all to walk away with some new knowledge. And for those of you who work in addictions, when I go to lectures like this, I kind of think, oh, they said something, oh, I forgot about that. So I'm hoping to renew information you already have and to reinforce what you already know. I will be discussing basically three things. One is I will present the definition and description, what is addiction, both medically and therapeutically. Secondly, I will look at the effects of addiction on the family system. And then we will discuss how we can help the family heal. Those are basically the three areas. Oh, somebody's looking at me for that. I didn't understand why there was a voice.
Why don't you just put it on this book here?
Yeah, to put it right here.
Yeah, top against here.
Hi, whoever you are.
The other way.
No, just make sure it's recording. It's not recording now. I think I touched the button.
Hello.
Check.
Can you see him now?
Yes, I can see him clearly. Thank you so much. No, you need to graze it. Perfect. Thank
Okay,
you so much.
great. And though we're presenting some information that Lena suggested, please feel free to chime in and say, Daniel, what about this? And if you have any specific questions, I can probably add it to my lecture as time goes on. Okay, so let's take a minute and talk about what's a definition of substance abuse. It has changed over time. In fact, in the first DSM, the term they used was addict, and it was addict. In the last edition of the DSM, I should say the DSM-4, there were two categories called substance abuse and substance abuse dependence. And now in the DSM-5, they call it substance use disorder. So the word addiction is no longer used. It's sort of passé. It used to be called substance-related disorder, substance-related addictive disorder. So it's changed over time because more specifically,
What does that mean?
they no longer use the term addict anymore. It's substance abuse disorder.
What's the difference?
I think they changed it because it was not exact enough, and it didn't give an exact description of what this disorder, and I think it also gave a negative connotation, and it was too easy to say, well, you're an addict, you're an addict. Well, why they also changed it, they began to change the levels. I don't remember the old ones, but the standards now is low, medium, and high. Before, years and years ago, it was like you were an addict, and that was it. And then they had Axis 1 and Axis 2, if you remember that. So it's a little more precise. The other thing that the DSM doesn't cover yet is what's called behavioral addiction. Behavioral addiction includes gambling, sex, computer, eating, shopping, computers.
Porn.
Well, that's sex. Sex addiction. Strangely enough, when I opened up my private practice, I have about 5 clients, men, who have problems with sex addiction, which I was very surprised.
Was too much or too little?
I was surprised that there were that many people that were having that kind of a problem. I didn't expect it to, and I just expected other kinds. I got my first addict to smartphone.
So let me understand. When they had addict, so that was, in my view, that's great. Then it's everybody. Now you're saying the behavioral just dropped out. Now they don't even have it.
No, they haven't added it yet. They have gambling addiction as in the addendum that needs more research. But behavioral addiction is still not put inside the DSM itself. They're behind. Is what
Yeah,
they're
so I'm
saying.
saying like they lost something. It's supposed to be updated and better, but I'm saying they lost something.
They lost something. I mean, I think it was good that they got the term addict out of there, and they changed the terminology where there were levels. Before there were no levels. Criteria. That's a better term.
Yeah, because the word abuse is an important word to switch it to, because I don't know how you're going to define addiction to a smartphone when everybody can't put their phone down for a second. If abuse is something else.
In a few minutes, I'll explain to you what the definition is, so that I think it'll give you a better understanding of that.
Gambling is going to be the hot one very, very soon if it's not already heating up.
Well, they have GA in Israel, and they have SAA in Israel.
But what I'm
Sex
saying
Anonymous.
is that the increase of legality, especially in the States now, with the online gambling and the sports, and other states that are legalizing it, and the increase of advertising it because of the connection, because of the endorsement deals that they have with the leagues.
Supposedly, the Harrods in Eilat has a room already set up, and they're just waiting for it to pass in Israel. And Aryeh Deri has been blocking it all these years, but that's the rumor.
Why is he blocking it?
Because he doesn't believe that addiction, is a good thing, and it affects low-income people and so on and so forth. So they've been trying to block it. But the story is that in Harrods in Eilat, the room is ready. They just have to unlock the door. I don't know if it's true or not, but
Might not be the best location to have one.
now behavioral addictions are cravings, strong urges, and disruptions in one's functioning related to a particular behavior, specifically reward system pathways in the brain become activated when one engages in this behavior. So the dopamine, the serotonin, all that stuff is bouncing around in your brain as you're doing that. And they still haven't.
Hard to fight that.
Right, and they don't have the classification. Now, people have asked me, what's more difficult, drug and alcohol addiction or behavioral addictions? And I always tell people behavioral addictions, because with drugs and alcohol, it's like you don't use. But people who have computer addiction, food addiction, sex addiction, all those things, you still have to do, you know. So we have to control that behavior, where with alcohol and drugs is not, you can drink a little bit or you can use a little bit. It's very cut and dry. So to me, behavioral addictions is actually harder than substance abuse addictions.
I call them abstinence-based addictions, meaning you can abstinence, gambling, alcohol, drugs. Those are things you can be abstinent. You're going to die if you know. I mean, truth of the matter is, you're not going to die if you don't have sex either. But you will die if you don't eat. You will, you know, like things.
But those are functions that people still have. So
Correct.
in the
That's what I'm
context
saying.
of
You can
right, in the
just
context
be abstinent, and there's a very clear definition of sobriety. You either use it or you don't.
right. So here in this particular case, in behavioral ones, it's a little difficult and it's not as cut and dry, because you still have to use, meaning you still have to do those functions. And what happens is the addiction literally changes the neurotransmitters in your brain, and it doesn't matter whether that's caused by drugs or alcohol or by computer addiction or whatever. So the addiction is a biological, psychological, and sociological problem, meaning there is a change in the brain, and just because you stop using, those neural pathways don't disappear. What is the purpose of going to meetings and therapy and so on and so forth? Is to overlay new neural pathways. The problem is the old neural pathways are still there, and those won't go away. And all it takes is a certain situation to trigger it, and it'll go off. A quick story, I had a client once, he was sober from alcohol, and he was out with some friends having dinner or whatever, and he tells a story that there was somebody walking with a tray of wine, and he just sort of saw it in the side of his eye. That was all it took. There was no urges, there was not, just, that was enough for him for it to click. So
When you say neurotransmitters, what do you mean? Like what happened in this case in his neurotransmitters?
Did
Like
he take the wine?
It's impossible.
In the end,
for him
he did.
to-
He just
I don't think it was that day. I think it was the day after he went
Or
back
he's
to
thinking about the pleasure he gets from that activity, and sort of like a reminder. when he's-
Again, we're talking about we're talking about two things that happen at the same time: the behavior as well as the brain that says, "I want that sensation." Now, there's another theory that says that in the pituitary gland, where they spritz out dopamine and serotonin, there's a theory that says that somehow the pituitary gland isn't spitting out enough dopamine and serotonin. So if, let's say for the sake of argument, it's supposed to spit out, 5 milligrams, a person is getting 4 milligrams. So they use the alcohol or their addiction to lashlim, that other milligram.
That's
but we don't know
connected
that.
with depression as well.
I'm absolutely true, but they actually can. That's what their theory is.
Wow, it's new. Okay. That's
So
very interesting.
neuroplasticity cannot change those pathways.
Right. No. And that's part of the problem is that just because you stop for a period of time and you do the right things, the old neurotransmitters are there. That's why and I'm sure you know this. I'm sure you know this. The adage, how for every year that you use, you need 1.5 years till you become normal. Okay, that's sort of a joke, but it's true, because it takes that long for the brain to make that adjustment. So the client said to me, okay, let me see, I'm going to be like 100 before I'm normal. But that's the reality. Because of the changes in the neural pathways in the brain, you can't just erase it. You can't delete it. It's there. And the stronger your new neural pathways take hold, the less the old neural pathways can override it.
It's just the thing is, I was reading an article and things. if you look at a person, they can do brain chemistry, and they put the stuff on your head, and they can see the parts of your brain that are firing. The same parts when somebody's doing addictive behavior or pornography, other types of things are firing the same as cocaine.
Oh, absolutely.
It's
It's all
the
the
same
same-
part of the
it's
it's
the
all the
same
same part of the brain.
Right.
So when
does
somebody's
the-
doing
it
addictive
is the
behavior,
same.
it's just saying it was interesting to me to
And-
understand.
Yeah.
that.
And what I'll explain a little bit later on is it's addictive behavior. So even if you stop using, it's not just about not using anymore. It has to do with a way of thinking. It has to do with the way of managing your emotional self. So just because you stop doesn't mean that you don't do addictive things. I know a client who stopped because the Love for Ministry was going to take his kids away because he was drinking a bottle of cognac a day. So he stopped.
Okay.
But then he worked 60 hours a week. And he disconnected from his wife. I mean, he didn't use, but he flipped into another addiction.
Can't leave the vacuum.
Now, addiction causes the brain to ask for more. So your brain has been used to getting all the spritzes of dopamine and serotonin, and suddenly, I mean, it happens naturally too. It's supposed to. You smell a pie and has certain associations, and then your brain does all kinds of stuff. The problem is that it's not only it is a biological and psychological problem. People believe, well, if you stop using, then that's it. In fact, when AA started, they didn't have the 12 steps. They had just 3 steps. They first basically said, step 1 said stop using and connect to a higher power. And then they added the 4th and 5th step, the 8th and 9th step. The 4th step is you do a moral inventory. 8 and 9, you list all the people you affected and ask for and apologize. So they began to understand that you have to do some work on the inside. It's not just don't use anymore. Just because you stop using, you still have that addictive stinking thinking. Addicts as a personality type are people extremes. Either they're too much or too little. Either they get too angry or not angry at all.
I mean, you're putting all the levels together, I assume. Like you're talking about the highest level, because it's not really it doesn't sound like possible to overcome it the way you're describing it. I assume there's a level 1 that it is possible.
It's
to
always
overcome.
possible, but the statistics show that you're only 30%. That's
In
the
the
bottom.
first level.
What the last
30%.
statistics I saw, only 30% of people after the first year stay sober. That's what
30%.
statistics say.
In any of these.
That's what they say.
You're talking about going to meetings and stuff, or treatment centers.
If they
No,
finish
getting off the
treatment,
addict,
Right.
finishing treatment, and they put it out a year, only a 30% continue. I mean, some cancers have a higher rate of recovery than
I
addiction.
think that's high.
You may be right. I'm just saying what the last time I read.
That's first year. That's first year. That
No,
doesn't mean
I
that every
think
5
more
years that it's
people go
still.
back out. More than 30%. I mean, meaning
He's saying,
30%.
he's saying within the first year. It could be the sum between the 2 and 5 years.
If they understood the law.
5% more, 5% less. But the point of it is,
Is there understanding of the length of
30%
time
stay
that
sober
it,
or 30%
it's like if you are in that
Only
30%,
30%
of
stay.
that 30%, 3 years later, what percentage?
I don't know. I don't have any. Didn't read any statistics on it. The statistics I've seen has only been a year out. And in my personal
Curious, longitudinally. like
in
what
my
happens.
personal experience, it's true. I think it would increase, and they don't do that enough here. I'm getting off sort of script. Is I believe that most addicts need antidepressants.
Yeah, that's what I was
You
just
know,
thinking.
the first 6 months to a year. But most psychiatrists only give antidepressants only when there are symptoms. And anybody who stopped drinking or drugging or doing their addiction, they look back behind them and go, oh man, what did I do
Right.
in my life? That's going to depress you, anybody.
Quite depressing.
So I think we could increase that if we allow people to give antidepressants, but psychiatrists, at least in Israel, don't all agree on that. So many of these people relapse
I
because
just
of that.
wanted to confirm. You're saying no matter how little a person's addicted, it's only 30%, or it's on the highest. It's just even out.
I don't think it has to do with how much. It doesn't matter whether they use every day. If they're in the category of substance use disorder, it doesn't
Whatever the
matter.
criterion for substance
Right.
abuse
I
doesn't
have a
matter, and that they can
question.
get.
I have a question.
Yeah.
Hi, Chagit.
How much of your hello everybody? How much of your knowledge from your experience brings any of the success that 12 step has brought to many I'd like to say addicts, many addicts that, I mean, if you look at the first few pages of AA, it says about millions who's been healed, not healed, been no longer addicts because of
But
the so,
their success rate is, as far as I know, is not any better or any worse. I mean, I have a client who was in Sex Anonymous, and he was part of their hotline, and by the time the person gets to the meeting is maybe 5, and maybe out of the 5 stay 1 or 2. So for me, my success rate is higher if they're both going to meetings and doing the 12 steps and doing therapy. Together. Now that doesn't mean if somebody goes to meetings that's not being enough. I'm just saying the combination is very good.
We're still in the 30%, though.
And nullify the therapy. I'm talking about
That's
that you're saying that all of them need to be on,
Well, it often does.
medication for depression for the first year. That's a very extreme statement, especially when you're saying
Yeah,
that
I
the
think
addiction
sometimes-
has
Guys,
one,
can
two,
I'm just gonna
three
add
levels.
something as soon as I keep starting.
I'm sorry.
And we know that with the program telling you that actually a person who is addict is God hunger. It's not so much about the physical malady. It's the emotional. It's the spiritual sickness.
It is a spiritual sickness, but also in AA, they don't. There's no reason why you can't take medication. People think that, and that's not true. AA does. If you read the Big Book, I'm sure people are familiar with that. It's okay to take medication. Now, I'm not necessarily saying that everybody does. I'm just saying my own personal experience that if the person, after they stop using, I think that.
I want to tell you, be very careful when you're trying to make your own statement because you're spraying it for a whole population of people. I mean, especially now, I believe that everybody is an addict. Everybody has addiction
No.
to something. So
No, I'm sorry. No, I don't agree with you. I don't agree with you. I don't agree with you. There is a specific criterion for what is an addict and what is not. There is a specific criterion of what determines an addict and what determines not. There are people who maybe are obsessive about something, but that does not determine what an addict is. So there is a very specific terminology and criterion to determine whether somebody's an addict or whether somebody's not. And I'll talk about that.
Why don't we start with that? Who is an addict?
Well, I will get to that. I will get to that.
You mentioned it already.
I will get to
You did a good
that.
Well, I don't want to interrupt you again, but I'm going to, because I just want to mention the other side.
Well, he did say he's open to discourse. That was a
Yeah.
mistake.
Yeah, oh boy. No, because you were mentioning about how few people make it in the first year. I just want to mention the other side though is, in everything, as far as I know, cigarette smoking certainly.
Oh, yeah.
Many people, they stop and they fail and they stop and they fail a lot of times. So it could be, we're talking about the first year when they start stopping, but a lot of people make it eventually. And they don't make it right away. But
I'm only
eventually-
telling you, Adam, I'm only telling you what the statistics say. I mean, I don't know
No, I'm just saying about.
further out.
I'm just saying the first year, but I'm just mentioning the other side of it.
Oh, sure.
Because I think it's important to know that people who fail, so to speak, they didn't fail because life is still there. As long as they're alive, they could still stop later on.
So let me
It's good to
get.
have hope.
Yeah.
We are supposed to be hope merchants. That's
So
the AFS sentence.
let me talk about the disease concept of addiction, which has been around for a long
Yeah.
time.
Yeah.
What did it say?
First of all, in the American Medical Association classified alcoholism a disease in 1956, included addiction as a disease in 1987, and in 2011, the American Society of Addiction Medicine joined the AMA in defining addiction as a chronic brain disorder, not a behavioral problem, or just a result of making bad choices. Now, Jelinek, who was sort of the father of all this idea,
When you say addiction, there you're referring to substances.
all kinds of
No,
addiction.
because you said alcoholism was a disease in the 50s, and then in the 70s was addiction. So
And
what-
then they moved, and then they
It doesn't
applied it to all kinds of
Okay.
addiction, not
Just
just.
understand.
It first started off in
It
alcohol.
doesn't really matter.
Okay, I was trying to understand the history. Okay.
Okay. And then we talked about the behavioral addictions and how, to some degree, it's a chemical kind of thing, but it's sort of like, when you put a rat in a maze and you give it
Yeah.
we're designed that way as well. As much as we have free will and the ability to choose or not to do something, we still have the biology. And the biology says, I'm in pain. I know that this action is going to stop the pain, so I'm going to keep doing this because the pain is there. There's a very good, very, very good possibility that it has to do with the family of origin, et cetera, et cetera, et cetera, et cetera. And we'll talk about that in a minute.
What about behaviors that we view as positive?
Like
Ish.
work, what you mentioned.
Like work, or, I mean, is there a line? I mean, I'm just thinking, like, every day I want to exercise and that definitely makes you feel better.
Right.
Definitely does create the same feeling. So, well, yeah, I mean, healthy, but does it become too much? Like, how?
Actually, you want to start about that? I had a
Well,
client. I had a client in
it may
Pittsburgh.
not be.
I had a client in Pittsburgh. How did he jump from one addiction to another?
Yeah.
He now in Pittsburgh, where I went to the University of Pittsburgh, it gets cold in the wintertime, and he started running. You know, it's a good thing. You know, and when it gets cold, I mean, you can't go outside. And he would tell me this. How did he tell me the story? I wanted to give him some coffee. He said, No, I don't drink coffee. So why? Because there's substance in it. I don't understand. Sit. So he tells me the story that he started to get an exercise, and when he couldn't exercise, he was in his apartment walking around like a tiger inside of a cage. So he started running. Now, normal people run 2 or 3 times a week, 10 kilometers. No, he ran every day, kilometers. Over the course of time, his knees started hurting him. Now, like most addicts, they don't connect to their pain, both physical and emotional pain. That's the whole purpose of having the addiction in the first place, is to numb whatever that pain is. Over time, his knees started hurting, but he put it up. No. Middle of a run, boom, trach. He fell on the road. The ambulance took him to the emergency room. The doctor said, "Listen, buddy, either you stop running, or I'll see you in a wheelchair in the future." And this is not the first time I've heard this story. So the problem with addiction is it's always there, and you always have to be aware of how it can come out. And you say, well, running is good. Anything positive is good. When does it become problematic? When it crosses over into an addiction. So let me define.
When it becomes problematic.
Right. Now, why was this defined a
I guess
disease?
the difference
Well, what
between a good
makes it-
habit and
What makes it
a
cross the line?
The dosage
I'll get
makes
to
the
that.
poison.
I'll get to that.
like a good habit,
Yeah.
and then when does it flip over? Like
Right.
Yeah.
And I'll get to that in a minute.
That's
Now,
like what I was thinking.
why was it defined as a disease? Because the general, and it's interesting, in Hebrew there is no word for disease. There is choli, chole. There's a difference between a disease and an illness. A disease in general is defined by 4 parameters. One is that it has symptoms. If you don't treat it, you will eventually die. It's chronic, meaning if you have it, you will have it for the rest of your life. And there's a genetic predisposition. So the flu is an illness. Sakeret, diabetes, is a disease. Okay? So that's how they began to understand that it was a disease, that's because based on this criterion of what a disease is. Okay?
Could you review the criteria?
A disease is defined by symptoms. If you don't treat it, you will die. It's chronic, meaning when you get it, you will have it forever. And there's a genetic predisposition. It doesn't mean if it's not in your family, you won't get it, but there is a genetic predisposition, and I'll talk about that in a little bit. Now, I have we talked about the DSM. I have a more psychoeducational perspective, which is, in my opinion, much easier for people to work with. And basically, we have 6 life areas. Family, spiritual, friends, or you could say society, work or school, our physical health, and our mental health. Now, I developed this because people would say to me, well, I only drink once a week, or I only drink, because you were asking, how would you define somebody being an addict and somebody who doesn't? And it's very simple in my mind. If it affects at least 2 life areas, you're an addict. Number 2, there has to be an increase over time. So if, for instance, for the sake of argument, you drink a beer every day, you're not an addict. If over time you drink 2 beers, 3 beers, 4 beers, and it begins to affect at least 2 life areas, you cross into addiction. So there's a difference between doing something a lot and being an addict. So in order for the person to be defined as an addict, they have to at least have 2 of these life areas, and there has to be an increase.
Okay.
We also need to ask when you do an assessment to find out if there's in genetics, because if there is, all this is just multiplied. So this is real simple. It has nothing to do with how much you use, has nothing to do with how much sex you have or how much you drink or how many. 2 life areas and increase over time. End of story.
So you're not an increase. You're not one is not an addict.
If there is no increase,
But it does affect the others. You're saying that
there's no way, because if you drink 1 beer a day, it's not going to affect life areas. If it increases over time, it begins to affect life areas.
But that's beer. But let's say you use gambling as the exact
Same thing. If you, let's say every day you go to Mifama Pais and you buy 50 shekels every day, you're not an addict. But if you buy 50, 60, 100, then it begins to affect life areas. If it doesn't affect the life area, you may use a lot, you may be quote unquote abusing your addiction, abusing this particular behavior, but that does not define you as an addict. Now, when do you cross that line? It's all relative. But this way, it doesn't matter how much you use, it doesn't matter what you use. If there's an increase over time and it affects 2 life areas, you're an addict. End of story.
So you made this up yourself? It's beautiful. Wow.
And it's very simple.
Really
And what's good about it is you don't get into an argument with your client. Well, I do this too much. I drink every day. It doesn't matter. If you drink every day, no increase, doesn't affect life areas, you're not an addict. You may use too much. It may not be a good idea, but that doesn't make you an addict.
Nice.
Affect. Can you define how you define
affects 2 life
affect?
areas.
If mental health, meaning you treat yourself, your depression. For instance, about 10% of addicts suffer from dual diagnosis, okay? Alcohol is an antidepressant. Once you take the antidepressant, usually the addiction goes away because you're treating it for what it's for. They actually have a pill against it. Once I can't imagine how many people I've lost in treatment because once they get the medication, they're feeling great. Spirituality. What do I mean by that? It's more like a sense of your moral compass. To be an addict, you have to turn off your guilt because you get up the next day after your behavior or whatever, and you feel bad, and you don't do it again. Let's say I don't know, you ate too much or whatever. You say, this doesn't feel. I'm not going to do this again. But somebody who's in an addict position has to turn off their moral compass in order for them to use again. How do I know that somebody's doing better? Is they start feeling guilty about stuff. Not that they stop feeling guilty about their drinking, which is when they first come in. They feel guilty they drink or they use or whatever, but they begin to start feeling guilty about other things. They begin to start feeling afraid of not using. They begin to start feeling afraid about other things. So I know that they're on a good path. So 2 life areas, increase over time, genetics. Now people are asking, these again are my way of looking at the dargot that I talk about. There's user. So anybody who drinks a glass of wine, let's say for Shabbat, we're users. There's misuse. I say in Hebrew, mechapes siba lemisiba. It's like it's Ben Gurion's birthday. Let's go drink. It's Maccabi Tel Aviv made it. They're finding a reason to use. Then there's abuse. And I call this psychological addiction, meaning I can't do something without some support, some help. I can't have sex without it. I can't do a speech without it. They begin to start associating the act as a way of helping them overcome some emotional struggle that they're having. And then the last one is what I call addiction. And that's people who, let's say for the sake argument, have the shakes the next morning and they have to have a shot in the morning, for instance. But this applies to all addiction.
So, in the media, because if you watch like anything, you will see many times written into lots of scripts, the actor drinking consistently. And it's like, you just kind of wonder about that visual, how it affects people. Like they're having a hard day.
Absolutely.
And it's so interesting that it's like the media hasn't.
But I'll tell you something
that's such an
positive
interesting-
about that.
Okay.
Over the years, almost every sidra that at least comes out of America, there's always this part of it where they're talking about addiction, and they go to AA meetings. Not here in Israel yet, but almost every
They're
single program.
They'll say you should go to a meeting.
Right, and you have characters who have an addiction, and you hear the word AA, you hear the word
Yeah,
NA,
that is very true.
and it's taken a long time. Hopefully, that will seep into.
So that's a new thing?
Yeah, relatively new.
They actually have a show that's about Alcoholics Anonymous. It's called Mom, where you actually see people sitting in. I mean, to go to AA meetings, it's all about a mother and a daughter who are both addicts, and the whole AA thing. It's actually really.
They also have a program called intervention, where it's a technique to get people into treatment, and they have a whole intervention thing.
By the way, watch Mom if you guys watch TV, and watch it because it's really it actually, the guy that's the creator is in the program, and so it's a comedy, but it's funny, but it's actually pretty funny true, meaning all the craziness and all the things that people do.
Yeah, that's what how do you use the media to help? I know they're doing it more with eating disorders. They're aware of all these things.
And what
people have different body types more like.
And what I want to tell you on a personal level, the reason, in my opinion, there's a lot of people drop out is part of it. Many of these people need antidepressants to get them over the hump.
Yes.
But and I'll talk about that a little bit more, is they think, well, if I stop using, then all the problems go away. Well, if you stop using, 49% of your problems disappear. Without meetings, without anything. But to get the 51 plus, you got to do the work here with you guys, going to meetings, et cetera, and that's part of the reason why it falls. Yeah.
One of the biggest addictions that's creeping up now is the opioids addiction.
Oh yeah.
Which often starts for a good reason, meaning a person needs it because they're having a pain or a surgery and things like that. So using this chart where a person is already starting and they have mental health issues because of the pain or physical, and there's a surgery and things like that. So can you describe how one transfers from user to misuse to abuser to addiction within just these opioids that they're being given?
Part of the problem with the opioids, because it's so fast, is because the molecular structure of it biologically is very, very addictive. Anytime you start using pills that come from a company, you tend to get not street drugs, because there are street ones of opioids. You become less addicted. To get off of medication is very, very difficult. Much more difficult than, let's say, heroin, for instance. And even now, you don't have pure heroin anymore. So there's the physiology of detox is just terrible. It's really, really hard. Physically first. Actually, I've talked to many doctors, and they say the most difficult addiction to get off of is alcohol. That it's really hard on the body.
Yeah, you can die.
Yeah. One of the examples, when you deal with cocaine and you deal with heroin, for example, there's no misuse and abuse.
Yes, there is.
Don't we tend to view it as automatically once you use cocaine, as opposed to?
No, there are a lot of people from Vietnam who were heavy users. They came back to America. They were gone. Like I said, there's a very different definition. There's somebody who uses a lot, and somebody who crosses the red line and says he's an addict. Very, very different. So if, for instance, every Friday night you use cocaine, that's fine. But if you start using it more during the week, et cetera. Now, certain medications, certain chemicals become addicted faster. For instance, drug addicts become addicted, meaning 2 life areas plus, in about 8 years.
8 years.
8 years. Alcohol is about 12. Gambling is about 15.
Wow.
So, I mean, I don't know what the other addictions are, but that's what I know.
That's
meaning,
a long time.
Yeah, until well, actually, I should say it's all life areas. I should be more specific about it.
Until your life is a real mess.
Right.
That's why people.
So behavioral addictions
so
take longer, and chemical addictions are much shorter because the physicality of it. Now, I want to be fair. There are some people who do not believe in the disease concept. People in NLP, people get training in NLP, believe that you can use NLP, neuro-linguistic programming, to change it. There's people in the psychoanalytic community that look at it from a very different perspective. That's not the camp I come from, for good or for bad. And they even now are developing a perspective now of what's called danger reduction. So it used to be black or white. Either you used or you didn't use. Now they're saying maybe we can help a person reduce the damage that their addiction does. I'm sure there's a small percentage of people that can happen. I'm of the perspective of black and white, in my opinion.
It's called dangers or harms reduction.
Harms reduction, that's the term. I couldn't think of it. I couldn't think of the
I remember
term.
hearing years ago that this is specifically what they tried to do with alcoholism in the UK. Because in the UK, the issue was binge drinking. And people would finish work on Friday and then spend from Friday till Sunday just drinking straight in the pubs. And that they realized that if they came across with the disease concept of saying that you just can't touch the beer at all, or any alcohol at all, they would fail immediately. And that was what they were trying to implement specifically there with those binge drinkers.
Well, usually when I have people who are binge drinkers, I tend to fall on the perspective that they're suffering from, many times when I hear people who are binge drinking, I sometimes automatically think that they may have depression. And that's why they're binge drinkers. Once they get their antidepressants, they're no longer binge drinkers. Again, it's not all of them, but usually if I hear somebody who's a binge drinker, or somebody says, well, I drink up to this amount, or I use marijuana, which is an antidepressant in the body, then they fall into a different category. They fall into that 10% category. But not all binge drinkers are addicts, but you have to be careful that they may be both, an addict as well as having a mental illness, and they're self-medicating themselves. Now, I want to take a...
In England, it's so culturally done.
Yeah, I was just thinking how
Yeah,
cultural
but
it
it's
is
so
in England,
cultural,
right?
And I know
As you said, it's a very
a cousin of mine who's a doctor, and when they get together and all the doctors together, the amount of alcohol that goes is
Oh, the Russians, it's unbelievable.
No, in England.
No, but Russian Jews too. It's terrible. Though it's interesting, basic statistics used to be that the addictions that was the most highest among Jewish population was alcohol. That has shifted over time, but that was, and then of course the Jews aren't addicts. My mother, God rest her soul, I was working with addicts, and she said to me, I worked in the prison service, and she said, well, are there Jews there? I said, yes, Mom, there are Jews that are sitting in jail because of addiction. Now, if tomorrow we could give a pill negative against addiction, about 30% of the prisons would be empty, because a large portion of people in prisons, either directly or indirectly, and I'll talk about that in a minute, are there because of substance abuse.
You wonder in these countries like England and Russia, though, there's not so much sunlight.
Mm-hmm. Could be. Now let's talk about the genetics for me, because I know you asked about that.
Well, before you do that, you said 8 years for alcohol, 15 years for gambling, and what was the 12 years?
No, 12 years for alcohol, and then 15 years for gambling.
Oh, okay. And what was the 8 years?
Was drugs.
Drugs. Okay, got it.
So is that?
Yeah. I mean, if you're talking about
You
getting
get,
old.
Right.
Completely messed up.
Right.
It affects all areas of your life.
Unfortunately, when do we get our clients? When all 6 are engaged.
Right.
They don't after two areas,
Right.
only after 6. Because unfortunately the human spirit says, if the water's here, it's not enough, it's gotta be here. Or here. Unfortunately. And it's human nature. I mean, we all do it. How many times did the doctors say to us we have to do X, Y, Z? And if you don't do it, you could get da 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 da, and we didn't do it. And then we got da da da
I'm
da.
surprised it's that long for gambling.
Well, gambling is a little bit higher because there's no substance involved.
Right, but I would expect that gambling, that when people are suffering, that they tend to double down and quadruple down on the bets, and a person tends to go.
That's true,
accelerate the process.
but because there's no substance involved, there's no there's physiology. It affects the physiology less than if you're using alcohol or drugs.
Right.
Again, it has nothing to do with how much you bet.
Right, but if it's affecting your family and your mental health, and you think I'll just make one giant bet, and then you lose that one, so now you're in double trouble.
That's
That tends to
Yeah, but that's
you tend to accelerate.
that's more of an emotional
process.
kind of thing.
Yeah.
So it takes longer. It takes longer because somebody who feels the same way, well, I'll just drink a little bit, and then over time their body's just a little bit's not going to be enough.
They're not doubling down right away. That's towards the end of the cycle where they're trying to get even. Meaning, in the beginning,
Right, I think it will take them 15 years to try to get even. That's my.
I mean, I'm in agreement. My personal experience with my own addiction was about 12 years, like from the time like
Really?
18. I mean, I started drinking. I mean, I had to drink at 13, 14, got in trouble. But when I started heavy drinking, it was like in college, 18, 19, all the way to 30. So
Sure.
I got some 12 years, and I hit I hit all of them at some level, but the ones that I hit specifically were work and physical health. I started a kidney program.
Sure.
No.
Can I add one thing that I think
Sure,
is,
go ahead.
sorry, I don't mean to think,
That's
but
okay.
as a layman, I use more of a thing is the difference between somebody who's a heavy user and an abuser, right? The difference is somebody who's a heavy user uses when they want to, an addict uses when they don't, and you will hear that.
It's another good definition.
If I hear people say, I don't know what I'm doing, I don't want to do this, I didn't want to go out and do this, then you're hearing a person who's lost Bahira, and that's when they've crossed that line.
Right.
Now, a lot of people cross it a lot sooner before they actually realize, but to me, like when I talk to other therapists, when a person is telling you he's doing it, he doesn't want to, somebody that's like you deal with it a lot, so you have a better picture. That's a place where, to me, it says a person is.
That's why I like this definition better than the DSM, because
good.
all I have to do is listen to the story, and I say, well, is there an increase? So then I do sort of I do a fuch ala fuch, and I say, well, if you drink a beer a day, are you an alcoholic? He says, yes, because you drink every day. I do no. If you drink a beer every day, you're not an alcoholic. If you drink if over time you keep adding another one, then you fall into that category. So then we don't get into an argument of, well, I drink a little bit, I drink a lot, I do a this. Increase over time, 2 life years. Simple as that.
Would you say
Beautiful.
that even before you got to that point?
Good, I like
It's like you started 1, tomorrow you're having 2, the next
Right.
day 3. It's still manageable.
And no,
You caught him already.
as long no, there is
affected.
there are levels. We talked about user, misuse, abuse, and addiction. So they may be in the misuse section of their life, and they'll eventually get to the physical addiction
I'm
part.
saying if he is in a trajectory of getting there,
Right.
would you consider him today?
Oh, absolutely. Absolutely.
Even though he hasn't been affected yet. No,
But
not very soon.
because my guess is if we're technically he won't affect those life years until he moves from misuse to abuse. Then it'll begin to start affecting more life years. But usually when there's an increase, they begin to tell you, my wife is saying stuff to me, my husband's saying stuff to me, my kids are, you're hearing the stories.
So this is just a matter of time before he gets from one to the other?
Right. And everybody is different.
Just somebody who's a compulsive whatever, but he's doing it because he wants to do it?
We're not talking about compulsion. Compulsion is a different diagnosis, it's not the same. You can't, compulsion and addiction are not the same
How do you tell the
criteria.
difference? I need it. Is a compulsion not a compulsion?
Addiction is not a compulsion. It's its own category. A compulsion is something where it's sort of like for the sake of argument, if you have a person, if something is out of and they have to fix it, that's a compulsion. Okay? Addiction, remember, it has that bio-psychological and sociological connection. You have to do it with other people, you have the psychological issues that go along with it, and you have the biological. So it doesn't, if let's say you grew up in a dysfunctional home, and everybody had some level of dysfunctional, it doesn't automatically mean you're going to be an addict. If the genetics, which I'm going to talk about in a minute, are there, so there's a possibility, and if there's not enough structure, et cetera, then there's a certain possibility. But it doesn't matter. I know addicts who came from very rich homes and they still became addicts. So there is no way that you could categorize and say, well, if you have this and this and this in this family, you have the possibility of being an addict. It doesn't work that way, unfortunately. That's why this definition to me is much easier, because it doesn't get involved with how much do or how little do you do. They say, well, I stopped for a while. Yeah, but was there, upward and to yeah. Well, somebody who does an addict doesn't have to stop. They don't need a vacation because there's no need for it, because there's no upward trajectory and they're not affecting 2 life areas. Now, the genetics, what they found very interesting enough, they are able to find where it goes on the genetics, but like all issues with the genetics, we don't know what flips the switch. It's sort of like genetics works sort of like sort of like this, you know.
Like how-
You may have it on the genes, but we don't know what people, places, things, or
Gonna
conditions
make it go on.
are going to flip it.
Yeah, that's right.
So, you know, you know, you may have the gene, but it never flips on, and it may. We don't know what flips that, and whether that can be
Was it
interrupted.
anxiety, depression, trauma.
All those are contributing factors, but it says, okay, well, you came from the same family, you went through the same traumas, but and she has it on her genes, you have it on your genes, but in you it flipped, in her it flipped, in you it didn't. As we're talking about males and females, because I want to talk about that, many or most, again, I don't know the statistics, but many of the women who fall into addiction is a result of depression or physical or emotional abuse in their youth. Not all of them, but many of them.
So it's not genetics.
It could be the
Not genetics. It doesn't. Just because you have a father's in it doesn't automatically. Just like if you have a family of high blood pressure, doesn't automatically mean you're going to have high blood pressure. We're talking about statistical possibilities. But many women who fall into addiction, especially alcohol, do, and actually quite a few in gambling, especially after retirement, because they grew up in physically or emotionally abusive homes. Not all of them, but many.
I think you're throwing people off for genetics, meaning you're talking about family of origin versus, you're 8 times more likely to be an addict if you have a parent.
Right,
grandparent.
exactly.
But that's genetics, but you're talking about family of origin, which to me doesn't necessarily mean genetics, it's more
Environmental?
environmental.
Well, but that's the thing, is that they did some studies where they did people who were adopted, and many of the kids who were adopted came from addicted families, and they became addicts even though they were in a normal home.
But that's genetics. That's what I'm saying.
Yeah.
It's not abuse or whatever. Meaning is that you have that gene that gets passed down genetically.
Correct.
You're talking about abuse, which is not a genetic thing.
Correct.
It's
Correct. And not everybody becomes an addict because of genetics. Not everyone, for instance, is going to have high blood pressure because of genetics. But statistically, when you go to the doctor and they see your blood pressure going up, they're going to ask you, is it your father, your grandfather?
So, but it's confusing for me because we see a lot of people. I categorize everybody as addict if it's destroying their marriage or it's destroying their life, but it's wrong. I understand. But this genetics piece, it sounds like, I'm just asking, everyone could fall in, even without genetics, into the user, misuse, abuse category?
No.
Just not the addiction category?
No. If
Addiction
somebody's
needs to start as a user.
2 life areas
Well, everybody uses
going up.
use-
Everybody's a user.
Sure.
Everybody's using.
Everybody's a user.
And misuse is only if you have that genetics, or the genetics
No,
component?
Usually, if
Misuse?
somebody gets to an addiction, there's probably a genetic predisposition.
Right, and the misuse is no genetic, or there might be.
Might be genetic.
But
Might
it
be
could be
genetic.
not.
Could be not. But again, it takes time. They go from user, misuse, abuse,
Takes a
addiction.
long time.
So again, somebody who drinks a lot or uses a lot is not an addict. 2 life areas increase over time. Genetics is a predisposition, which is another factor you can take into your assessment of the client.
Yeah.
So
Sex addiction, you said, is how long?
I don't have one for sex addiction.
No.
I didn't have it. But my guess it's on the higher
Because
numbers.
you're talking about kids now who are adults.
I'm
beginning
sure
of
because it's
internet.
a behavioral, my opinion is behavioral addictions take longer to hit all life areas as opposed to chemically induced, because the brain, you change the biology of the brain much faster if you're taking a substance versus a behavioral kind of thing. So my guess is it's probably the same. Now they're saying, they say people with smaller amygdalas are more likely to develop addictions. Certain genes play a part in substance abuse. Those include serotonin receptors, what's going on in the serotonin in your brain. People with ADHD have a higher propensity for addiction, usually in the context of marijuana and alcohol, because there are 2 types of drugs that we use for people who have ADHD. Ritalin or antidepressants. So a lot of times there's a higher propensity of that. Now, I'm going to give you a little bit of numbers, and I don't want to get too dry, but these are really important numbers. There was an article done in 2022, and they said here 1 out of 7 Israelis suffers from addiction. and,
Out of
and
7?
1 out of 7.
That's higher than the numbers in the States.
Israelis suffer from addiction, any kind of.
All addictions. This was done by the Israeli Center of Addictions. Over the past 5 years, since the last time it was measured, addiction to sex and pornography has increased by 34%, addiction to drugs by 15%. The report from Addiction Center estimates that almost 15% of Israelis suffer from addiction. 2 life areas increased. Not somebody who drinks a
So
lot.
1 out of 7.
Huh?
See 1 out of 7. Now you see
1 of 7. So they said here about 15%.
15.
I'm curious to know what their numbers were pre-corona.
I don't know. It's an interesting point.
Which year is this?
Suffer from addictions.
Well, they suffer from a lot of trauma, a lot of Israelis.
I mean, a lot of going through, yeah.
In 2018, the center estimated the rate of addiction is about 10%. So let's look at the numbers for a minute.
10% is a number that you usually hear.
That's what I've heard. Now, if I did the math. If we have a population of 10 million, and 15% can be defined as an addict, that means 1.5 million people in this country are addicts, but they're not getting help, just so you know. And there's not enough help.
5 million people.
If we're
are
saying
addicts.
15% out of 10, that's 1.5 million. Speaking about treatment for a minute, there is one treatment center for alcohol detoxification for all of Israel. One.
Where is it?
One. Where it is right now, I forgot. It used to be about, yeah.
You're talking about like a hospital of government.
Right.
Because you're
Right,
private.
right.
Okay.
And for you women, there are only 4 beds. That's it, 4 beds for people who have alcohol problems. Now, for drugs, there are more detoxification centers, and there are more for women. And there's actually a very good hospital in Haifa. But that's it. 30 beds in all of Israel. Anyways, that gets me upset because I don't want to get involved in this.
Crazy.
So we're talking about 1.5. Now, if we take that 1.5 and we say, okay, each of them has a spouse, husband, wife, and you include 1 child for the sake of argument, it means that 3 million people are either indirectly affected by addiction. So you may be treating somebody for a problem, but they may be because they grew up in an alcoholic home or an addicted home. So we're talking 3 million people have been indirectly affected by that addiction. Whether they themselves are addicts themselves, but more importantly, it's like secondhand smoke. I mean, all these people get affected. So they may be coming in with emotional problems, but if you don't ask, is there addiction in your family? And there's a way to ask it in a way that you can get correct answers. You maybe need to treat them both as an adult child and an alcoholic, which is called ACOA, and there are meetings here in Israel. So you have to realize that even if we know statistically, first of all, those 3 million people have a higher propensity to become addicts themselves, for the sake of argument. But even if they don't become addicts, they're still going to suffer emotionally. Just so you know, a large portion of helping professionals, myself included, doctors, nurses, and so on and so forth, they fall in this category. They're adult children of. Just so you know.
I don't know how accurate that 10% or 15% is because, or maybe it could be even more than that because addiction is the highest level. And
Right.
I'm sure there's tons of misuse and abuse, and I don't
So even if, for the sake of argument, there are 30%.
I'm an addict, okay, but I could be a misuser, and I'm just
Misuse is not addict. That's what I'm saying. You have to make a very clear distinction.
Right. So I wonder how they.
The distinction is 2 life areas increase over time. Then you're an
He
addict.
asks if we could color back.
So it's very different. And one of the statistics here, the cost of addiction to the Israeli economy is estimated some 7 billion shekels, which is about $2 billion.
Wow, wow.
7
Hagit is
billion.
on.
She said there's.
Hagit's wave if you
She
see us.
says she needs to ask a question.
Oh, she's
Okay.
muted. Oh, she's muted.
She wants to ask a question. Can you?
Shoot.
But she would need to unmute herself.
I'm muted purposely. But what I'm trying to say is that the reception is not good, so I'm getting only a few words of what you have to say. I'm
That's
sorry.
always the problem.
Yeah.
That's the
Sorry.
Well, we are taping this, Hagit, so I don't know.
This is good. This is very
Okay.
good.
Now, I want to talk about these numbers. Okay.
That's the problem.
We have a very ADD crowd.
Definitely very ADD. We should all come with little stickers.
Did you have a question?
physical.
Yes, I would like to go on the addiction of sex addiction in the family.
Right.
There's a concept in sex addiction in family when the couples get together. There's a concept of full disclosure. I wanted to know what's your opinion of that.
Again, if the person is having a lot of sex with their spouse, with not their spouse, pornography, whatever you call it, I mean, I'm making judgments one way or the other. 2 life areas increase over time. So if people do, I don't know, kinky sex, you can't necessarily define that as a sex addiction. When does it become a problem? If it's 2 life areas, and I'm not talking halachically, and I don't want to, that's not my area of expertise, even though I went to yeshiva and stuff like that. 2 life areas increase over time. Okay? The time frame from user to addiction is different for each person. Now, what do these numbers mean as far as the family? It means that when you're treating...
You didn't answer the question.
Okay, what is again?
Question is, do you support the idea that when sex addiction has been discovered between a couple, is it a good idea to have full disclosure?
Like anything, it should be. If the couple or the person is willing to accept that they have an addiction, the problem is many times they deny they have the addiction. That's the problem. That's the catch-22.
I'm
you tell your
reiterate
spouse.
the question again.
Do you tell them?
I'll talk about that. I'll talk about that in a minute. I have sort of a feeling like in any addiction, to start doing marital therapy or couples therapy around any addiction is problematic.
Yeah, I would say that.
For instance, if you look at the 12 steps, when do you actually say to a person, apologize? That's the 8th step. Why? Because you have to do a whole bunch of work before you can do that. When I work with couples, my belief is the person should be clean at least 3 years and or finish the 12 steps. That's my personal belief. Otherwise, it becomes a thing like,
It's a mudslinging.
each are throwing grenades at each other.
Yeah.
So it depends. If there's an SOS, then you absolutely should. But to start working with the family, and I'll talk about that in a few minutes, you have to sort of weigh that out because there are pluses and minuses. Because if you do it too early, then you undercut the addict. But at some point or another, you're going to have to do it. So it's a matter of timing.
So I have just a
Thank
couple.
you.
Thank you. You're welcome. Good question.
I don't know if you can hear me, Chagit. I have a couple where, both of their family origins are like whoosh, their stories are kind of almost unreal. And now they get married, and he definitely is all sorts of substance abuse. And he and then he doesn't remember what he says.
Sure. Okay, blackout. Do you know what a blackout is? Some people don't know what a blackout is. A blackout, what happens is you take the executive function of the brain, and the executive function of the brain is shut down.
Yeah.
Okay? I tell people it's like you have an internal guard that tells you what's good and what's bad.
Yeah.
What you do is he goes to sleep.
Well,
okay?
he says a whole bunch of nasty things and then goes to
So I'm saying inside the brain. Forget about sleeping. Inside the brain, it shuts off. His moral compass shuts off, and so on and so forth. So he can be having a conversation with you, and he won't remember because his executive function has been obliterated, has been turned off. That's what's called a blackout. So he doesn't remember what he did.
It's not only from addictions, it can be other things too.
Well, of course, we have, that's why having insanity pleas and so on and so forth. Somebody, it gets very rageful. But I'm talking about, this is more of a chemically induced kind of thing where people blackout.
And then the spouse believes him. Like, he just gives her all this garbage, and then she'll send me a WhatsApp and saying, he has to leave, he just said all this garbage. And there's no way. I told them I don't really think couples therapy is going to work for you guys at the moment because of this. But my whole work, of course, is trying to get her to separate, to realize when he throws all this garbage at her, he wakes up, goes, "What? I would never say that to you." And her trying not to take it as seriously at this point in time. And the reason for that, even though he might mean a certain percentage of it, he doesn't mean it as much as it's being portrayed. And I thought it was a very important thing. And then I was helping her how to with that. She says, what if he really means it? He might mean some of it, but
It's an exaggeration.
It's a huge exaggeration. And that's so important because she's walking around thinking, and it's really important to realize
She's a
that.
human being.
People believe that somehow a
But-
blackout, somebody actually tells the truth.
He
That's
will
not necessarily true.
eventually.
Yeah.
He will eventually.
So
but
just a question on that, Mike. When
Forgot I
you're
bought
sitting with
that,
someone
sorry.
who
no, it's
has,
because he can't.
It's like guys.
when you're sitting with someone who might have, may or may not
Yeah.
have an addiction, and they have drunk a lot of stuff, like whiskey or whatever, and then like,
Mhm.
because I once kind of got frightened because it was a friend of mine
Oh,
dealing
you
with
told-
dealing-
Okay.
yeah,
you told me
remember,
that
and
story,
I actually
yeah.
thought she had a
Psychotic break.
because she started saying there's a tookie, and then she, whatever, she started talking like, and it sounded like a psychotic episode.
You
Now, what-
can, if you drink too much,
Yeah.
you can have a psychotic, but that's
Yes.
chemically induced
It's a chemical
by the
induced.
alcohol.
Yeah.
But what I was going to ask you is, how do you know what's the difference between a blackout or something that
Basically, if they still are hearing voices
In the morning.
in the morning or some other time, then you know it's psychotic.
Yeah, no, in the morning.
So then it's
Alcohol.
then it's chemically induced.
It's chemically.
It's chemically
different. It's not necessarily like that's not like a cause to go to the emergency room.
Well, yeah,
Alcohol
because
poisoning.
alcohol poisoning.
That's very serious.
Well, I mean, you've heard these stories that was years ago that these kids drank a lot,
Yeah.
and they beat this person to death, and they don't remember because they had a blackout. They don't remember that they did it. And in university, if you heard of alcohol poisoning, where you drink too much
Yeah.
in a very short period of time,
Most-
how long does it take for alcohol to leave your system? Guys that do the alcohol stuff, do you remember?
It's,
7 days.
well, no. You're talking about how it gets metabolized.
Yeah.
No, the half-life. What's
So-
the half-life?
No, that's marijuana.
It's a couple couple per drink.
Right. So
Couple of
basically, if you drink,
Alcohol doesn't have a half-life?
no, marijuana does. If you drink a cup
Or
of
a barbiturates.
if you drink a cup of alcohol, it takes approximately an hour for it to start leaving the system, and it leaves through because it's water soluble.
If you drink water, it's...
Well, no, that's not true, and drinking coffee isn't. What you've got is a very wide awake alcoholic.
Yes, that is very true.
Okay, it takes approximately, for all of the alcohol to leave from the system, it takes between 8 to 12 hours. But it's a low reduction. Why do people get drunk? Because the first hour they come down. Now, just as they were coming down, they drink again, pops back up again.
Right.
Marijuana has what's called a half-life. So if you take a marijuana cigarette, it takes 10 to 12 days for half of that to leave your system, and then another 10 to 12 days, a half of a half, and so on and so forth, because marijuana is a fat-soluble drug.
Yeah. Lasts a
Now,
long time, yeah.
with cocaine, what happens is they're galim of depression. So there isn't that much physical, but it's more emotional. A lot of times their alcohol connects with the cocaine and vice versa, because if you're doing cocaine, the alcohol serves as a cushion when you hit the crash.
Right.
So there's a lot of times you have people who are addicted to both alcohol and marijuana.
They do it all together. They up and down.
To see somebody get off of medication, oxycodone. I had a woman who was addicted to sleeping medication. It's terrible. You have to be very careful. The purer the pill, the harder the detoxification, and the more dangerous it can become.
I know people are very scared to try anything because they're afraid of getting addicted to
Now,
it.
hold tight. I want to say something. I'm an addict.
Please.
Okay. I mean, when I had my hips replaced, I was on morphine for 3 or 4 days.
Yeah,
Okay.
I remember that.
It was great, actually. It's like they gave me the thing to push, and I had a great time. And then they put me on oxycodone for another 6 or 7.
Were
Okay.
you scared? to go on the
Was I
oxycodone?
scared? Yeah, but I had people, and I called and whatever.
Okay.
After I went, okay, my hips hurt. No, bam, stopped. I didn't have a problem. Okay, so there is a place where I think you said people came back from Vietnam. There's a beautiful thing, Rat Park. If you ever want to watch it, I use it in my talk. Anyway, that 95% of the people that came back from Vietnam that were using heroin just stopped. Now they say
socially. that
right.
could be
So
said.
the thing with Rat Park was, so all we need to do is give people connection, and therefore they'll go back to thing. But they didn't talk about the other 5%. That's the addict.
Right.
The 5% that couldn't stop.
They couldn't stop.
That's the people that had addictions.
So I like what you talked about too. With addicts, what I tell them is, for instance, I had a client, he had a wonderful idea. When he would go to a bar mitzvah or whatever, couldn't drink. Well, what did he do? He had in his pocket an empty box of antibiotics. So he'd whip it out and go, no, I can't drink. I have antibiotics. You know, so there are certain things, like for instance, in America, I don't know if they do it here. In America now, all hospitals have stickers. If you're an addict, it's written on your chart. Now, interesting.
In Canada, they did something very interesting. They realized that with alcoholics, one of the biggest issues they were having with trying to get them sober was that they lost out the camaraderie that they had of hanging in the bar with their friends.
But that's
And
the
they
idea.
created-
AA. But
and
that's
they
the purpose
cre-
of
and they
AA.
cre- that they created specifically smoking bars that were just seltzer and smoking they allowed, so that because they figured most of the recovering alcoholics are smoking anyway.
True.
Which became a legal issue because in Canada the only places that could have allow smoking needed to have a liquor license.
Really?
So they needed to get a liquor license for alcohol that they weren't serving. Which became, but they realized that environment was needed.
But that's what AA does.
That's
AA creates
exactly.
a fellowship.
well, when
Not the same
I
way
tell
of-
people
of-
from a therapeutic
Sitting at a
perspective,
table with
AA is sort of like you have a bunch of brothers and sisters.
Yeah, it's
You're,
really
you're changing object. What's a sponsor? A sponsor is a object from an object relation that becomes a father and mother.
Yeah.
And the idea is that you get that corrective parenting. Now, the beauty of this AA family or NA family or SA family is that if somebody drops out, go back to addiction, that's okay. Somebody can go into their spot. Where if you grow up in a dysfunctional home, you can't go, okay, Dad, you're not healthy. I'm gonna get another dad.
Yeah,
The beauty of AA family or the anonymous families, and there are anonymous for everything. ADHD anonymous, there emotions anonymous, debtors anonymous, everything. There's based on the same 12 steps. So the part that I want to add about the family now, because this is really, really important, is what happens the other people that are affected that you have to treat still. Now they may not be addicts. And we're going to talk about adult children of alcoholics. Now how does this develop?
Right.
Not all adult children are addicts, but all adult children are affected.
Yeah.
So if, let's say, you have a father and mother, and the addiction is there, okay? Mother gets, and I'm being very stereotypical about this for the sake of argument. So she gets pregnant, and suddenly it comes down a little bit because, she's got to be a responsible father, so there's less problems, and the first kid gets born.
That's the alcohol?
No, not necessarily. I'll talk about that in a second. So now, they figure out, well, if I get pregnant again, things will calm down. Well, they have a second child.
Oh no, then they have a lot of them.
Yes, because while she's in this pregnant, then there's a reason not to use. And then they have a third one and a fourth one. Okay? Now let's talk about this family of origin.
There's a lot of stress.
Now, first of
all,
all these people have a possibility of becoming addicts because of the environment, because of because of genetic, etc., etc. Not all of them will be, but all of them will be affected. All of them, either directly or indirectly. So let's talk about the first kid. Kid comes home and says, "Mom, I got 100 on my test." Second kid comes home, "I got 98." First, mom goes to the first kid and goes, "Here, take a cookie." Second kid comes in and says, "I got 98." "Oh, that's good, son." Okay. So what we have here is the Superman, and we have the black sheep. And the problem is it keeps progressing the same way. So why does Superman have a potential? He becomes a doctor. Let's say he loses a patient. Now he's got to be Superman. Well, he just got a punch in the gut. So his emotional identity is based on being a Superman. Well, suddenly he's now the Superman. Well, how's he going to deal with that? Use. Okay? Again, doesn't mean automatic. I want to be very clear about that. Black sheep. Family's sitting around the table. Dad says, "Give me another beer." Mother says, "Oh, please, honey, don't do that." Black sheep goes, "Who the heck cares? He's going to drink anyway." And these people become criminals, do criminal things, do self-destructive things, and so on and so forth.
How do you get to be a Superman?
Because you're the first child.
He's the first one.
First child of an addict becomes a Superman?
Yeah.
He's reinforced
He's
also.
the savior.
Wait, he's getting 100 on his test? What do you mean
He's the
Superman?
savior.
I'm using it as an example. He's getting a
very
lot of praise.
stereotypical. But
What do you mean, he's saving who?
the family. It's as if you
He's
go
making them happy.
if you go
because
let's
they're
not
Perfect
if you look
child.
at systems work,
Why is he
somebody
a perfect
has to
child?
save the family. That's his role in the
But
family.
it doesn't have to be
What,
the
the
same the
parents
oldest. I
realize
know
they
the
have a
family
problem,
was the
that's
same.
No, for sure. I mean, nothing is written in stone. There's flexibility. It
The
also
baby
depends
gets
on
born,
if there's a
and it helps
difference
the father
between
to regulate his
if
weight.
there's
Regulate
one
do
right
save
after
it.
another. If there's a
So that
so I'm
it's
giving you a
He
general.
saves
the
by-
genes.
He saves
No, it's just
by
he
virtue
becomes
of birth
responsible.
order.
You know, a lot of women it will have baby. The same thing. They'll think, oh, you know,
I'll be okay. I'll have a
alcoholic
baby.
women. You'll see sometimes. Well, they'll get married, they have babies, and then they don't drink
Because they are
because they
responsible
think that they're going to
moms.
have. And if I just have a baby, then I'll have something that will stop me from drinking.
Someone will also love me.
and
And
then
attached to
it doesn't work. I mean,
Sure.
after a while. But so they'll do that as well. So the baby sort of helps to where the father says, oh, I can't drink like I used to. Mom gets happy, things are better.
For a little bit.
Baby gets born, father starts drinking. Oh, have another one, and like.
Because it worked the first time.
Right.
Right.
So
When it's too
so.
bad when it
And you
comes
can
to
have
sex.
very large
Families
you can have
around the
very large
table.
families.
Dad says, I want to drink. The Superman goes, oh, Dad, don't do that. It's not good for you.
Because something goes
The
wrong.
black sheep of the
He
family
doesn't
says,
have
what that is, doesn't matter anyways, he's gonna drink
drink
it.
it.
Let him drink. Third child, it's called the isolate. Third child's the one that goes underneath the table.
The
Or sometimes
isolate?
the isolate. Or sometimes he's the one that runs into his room.
He isolates.
Right. Last one is what's called the clown.
Oh,
Now,
yeah.
if you ever listen to biographies of actors and
Yeah,
comedians,
yeah.
a lot of them
Are
fell
that
in this
one.
category.
Yeah.
So now let's talk about these children as they grow up. So if the Superman is doing super stuff, he also wants to be in control. So he has a spouse, and he says, well, honey, I want to do, no, I'll take care of it. But now I want to, I'll take care of it. He becomes, and if something happens, it's a punch to his ego,
Doesn't
because
have a lot
his
of
ego
resilience.
has been inflated because that was his job, to take care of, quote unquote, take care of the family. The isolate, as he gets older, has difficulty in relationships because he doesn't know what a relationship is about. It's about, for him, it's about anger, it's about, just being pissed off all the time.
Yeah.
The isolate is also has difficulty in relationships because his relationship between him and his computer. Again, I'm being stereotypical about him. He's about, I don't want to get into a relationship.
It's scary.
And the comedian, wife goes to the husband and says, I had a difficult day. Difficult day? That reminds me of a joke. And no, something really happened. Oh, something really happened. Well, that reminds me of another joke. It's a way to, again, all these people are going to have relationship issues.
Yeah.
Even if none of these people drink.
That's typical of dysfunctional family in general.
I agree.
Yeah.
I agree. I don't want to disagree with you. You're 100% right. But this is sort of the model in general
Stereotypical.
of this. And what happens is these people become
Becomes a criminal.
these people become typecast for the rest of their life. Now
Unless they go to good therapy.
Dysfunction.
How's it
plus.
if the therapy interrupts that, if they go to ACO meetings, it interrupts that.
That's correct. That could,
And
if they
what happens is when you
recognize
become stereotyped, you can't do other things. So the Superman is always Superman, the bad guy is always the bad guy, the isolate is always the isolate, and so on and so forth, until they get the therapy or the help that they need to interrupt that stereotypical perspective.
Or
It's sort of like,
changing
some of you may be familiar with Christopher Reeves, the first Superman.
Yeah.
Okay?
Oh, yeah.
He died. He committed suicide. Do you know the reason why he committed
He
suicide?
committed
No, you're talking
suicide.
George Reeves, not Christopher.
No,
Christopher
no.
was the second.
Christopher was the one who fell off the
Reeves
horse.
fell
The first one. The first
George Reeves.
Excuse me. Thank you.
George Reeves. Oh,
He
was
committed
the first- he was the
suicide
first
because he was typecast as Superman, so he couldn't get any other roles. And part of the
He's
problem with
amazing.
these people is they become typecast, so now they can't get out of these roles
Wow.
until we and or ACOA meetings begin to interrupt that
Some people
this
like
automatic
they're
response.
Great role models.
Or Al-Anon.
Or Alana.
Al-Anon.
So it's important that all these people, you realize is that these are part of the, what did I say, 4 million or 3 million? These are part of the 3 million. None of these people necessarily, statistically, there's a good chance that they may be. I don't know what the statistics are, but it's certainly a good chance. But all of these people are going to have emotional issues and emotional problems. But if you don't ask
Well,
about
that
the
goes back to
addiction,
the attachment.
you might not know about this.
But that also goes back to attachment, which must be offside.
That's 100%.
Attachment.
And the purpose of the meetings, the purpose of our relationship
Is
is to
to
teach them how to
reattach.
find that attachment.
Yeah.
Because they didn't have the correct
And that's
attachment.
building a new neural pathway of attachment as well.
Because you're building new neural pathways. The problem is the old neural pathways
still there.
still stronger than the neural pathways.
That's
And that's why people go back to addiction, why these people end up going back to their destructive behavior, because they haven't, it's
hard to
too
build that
fast, it's
strong.
not fast enough. They think about this time. I say to clients, it's not just this time,
it's not that
it's
time,
this
it's that
time
time.
and this time. So you may have a lot of time in recovery, ACOA meetings, Al-Anon, et cetera, but we're talking about time here and time here. And until you work on this time, it doesn't matter how much time you
I
have.
think family members have a really hard time with this time because they're like, well, you've been in that program for 3 months. How come you're not better already?
You're getting ahead of it. You're getting ahead of it. So what happens? Why
Yes,
does this
but
happen?
especially when you paid a lot of money to send them to rehab and they come out only 3 months later and how come they're not okay and it's cost you a fortune and you had a mortgage off your house? Yes.
But they're making the same assumption that the addict is.
Yes,
The
I
addict is
understood that.
stop the addiction, stop the using.
Yes.
No.
But that's the problem with the education of what rehab really does.
Exactly.
One
So
thing-
part of the
one thing
problem
that
is
I've told people this when with kids that I'm dealing with something else, but when I started my weight loss program, I heard somebody say this. He said, I didn't put on my weight in 3 weeks, I'm not going to lose it in 3 weeks. He said, it took me years to get to the weight that I'm on.
100%.
I can't expect it to go off any slower. And the same thing when a
Exactly.
person has learned behaviors or addiction, things like that. It took you a
Yes.
while to reach this state. It's going to take ages.
absolutely, and it's a biological reason. You have to build new neural pathways. It takes time, over
But
and
even
over
without
and
giving
over
them
and
that
over and
information,
over
but just
and over.
telling them like it took you years till you reached this point.
I always tell people
It's
that.
not going to go any slower to get up. But
It's wonderful, but not for the family who suffered.
But the family is sitting there going, how come? I've spent, think about what they did. You know how expensive rehab is, especially if
Yeah.
they go private. They
it's
often
only
don't
5
have,
figures at least.
they don't have any money, so much money to begin with because of all this going
Yes.
on. They've now like scraped together money, borrowed, begged and steal to send their loved one to rehab with great hopes, maybe their spouse usually or their beloved child to rehab. The kid comes out, they relapse. Like, can you imagine what this does to the family?
Well,
It's just like,
the idea is if you stop using, then you'll go back to work and you
right, there's so much hope based on this, but the understanding of what it really does is there's not enough of that support or psychoeducation of what's really
But
going
it's
on.
hard to, but
And it's
Dina,
really
it's
hard to
very
do.
hard to engage the family. When I
Yes,
worked
and
at,
that is
very, it's
that
hard
is
enough for the addict. For
that
the
is the
family, it's
question.
because they're saying, here, fix it.
Exactly.
When you know, like we're like a musachnik, you know, we you go and fix it, bring it back. It doesn't work that
No.
way.
With all due
And
respect,
there, it's very hard
This
for
Bill
me.
wants to say something.
with all due respect, and this can be extremely stereotypical, but it's a very Jewish response of thinking that we could throw money at it and everything just goes away.
Absolutely.
Well, that's very true. And let's
that's-
to the best
I'm
we
going to
have.
add something. You maybe
No,
just
no, you're 100%.
Any addiction counseling that you do that you don't get the spouse somewhat involved with,
Yeah.
it's like a lot
Why
of
do
times when I have a husband or a wife, either one, but usually the husband brought in, I find a lot, or a kid, a teenager,
Yeah.
my work is with the parents.
Yeah.
Because they're enabling the behavior,
Which
and
is
it's not
big,
until
yes.
they say, oh, fix him, but they're still doing the behavior that's keeping him unfixed.
As-
And so it's
Exactly.
As a social
And when
worker,
when I
always tell somebody, social work is the study of a person in their environment. You're part of their environment, and they need to work with you.
change is not a sprint; it's a marathon.
What do
Right.
you mean
It-
enabling?
You're allowing behavior.
I'll give you an example.
Enables
But
very important.
please feel free to go in here. Addict is clean now, so the husband and wife goes, here, fix this. But for 15 or 20 years, he wasn't doing. How was he going to fix that? He's not ready to do that. If you look at this like a mobile, you know, if you cut off one of these pieces, okay, and it's out here now, it's over here now. It's no longer here. It's floating out here. Okay? Now you reattach it again. The whole mobile has been changed already. I mean, imagine if somebody, maybe you know this, because we're talking about a disease, somebody who had a heart attack. Okay? Now the person it's changed the family system forever. Forever. So the person could be a Superman. I'm running marathons and so on and so forth, and he's supposed to come home every day at 6. At 6:15, he's not home. What's the automatic response?
Fear.
What's the automatic? He's probably got a heart attack.
Fear.
Okay? So that's another element of the disease. It's not over. Even if you bring them back into this mobile, the whole mobile has shifted permanently. It will never be the way it was, or the way it should be.
Sounds of family enabling. What does it mean?
Can I give an example? I had a case where the wife, you do genograms. So the husband had a mother that was not mentally ill, kind of depression. Basically, father left. He took care of mom. Gets married, right? Finds a wife. She's also, at some point becomes non-functional, right? So everybody's like, that Nebuch, one of his things, he's taking care of her, right? She had eating, she was heavy, overweight. She went to program, started to get better, right?
This is classic.
At a year sobriety of her food program, he made her a cake.
Yep.
And she went, are you crazy, right? Because he needed her to be non-functional, and he was doing all the things to enable her.
Unconscious, not consciously.
Right, and not consciously.
He wasn't being a bad person.
Exactly, to
Your
do
favorite
all the
cookies.
things,
I
to
just
keep
love
her,
you.
don't worry about it, whatever. And anytime she tried to get out, no, you can't do it. He would function, he overfunctioned for her. And he kept her dependent because this is the way he grew up. And, again, you'll see a parent bail kid out of jail, right? I'll go to a parent. What do we do? Our kid's in jail, just got arrested. How many times have been arrested? 4 times. How many times you bailed him out of jail? 3 now. Okay, maybe you should leave him. Oh, I can't leave my kid there. Well, how's getting him out all the time doing it? Because, my kid can't pay his rent, right? Should I pay his rent? Well, let's see. If you pay his rent, what do you think he's going to use the money for? That he doesn't have to pay his rent with? Drugs. So, but I can't do that. So they keep on paying the rent. The kid keeps on, my kid's going to be out on the street. Well, I hear you. It's a hard decision for a parent, and it's a lot of work to do that. But at some level, that's the only motivation that person will have. So they keep on enabling the behavior, and and the kid's also very good at manipulating the parents. So they play against each other.
Or the wife goes out with the husband drinking, thinking that if I drink, I'll be able to slow his drinking down. Right. There's also the reason why they can't leave. There's a good possibility that they were one of these characters.
Correct.
So they may not have it, but they grew up in this kind of situation. So they're saying, I couldn't save my father, I'm going to save my husband.
Exactly.
And there's even worse when you mentioned the son. When you start dealing with daughters and from families, sometimes they start feeling of, oh no, if we don't start giving her the money, she'll go start selling herself, and we don't want that, and we don't want the. Then you start getting to the names of the family and.
Correct. There's all kinds of stuff that people play into.
So let's help the family a little bit. First of all, it's important you assess: is there ACOA? Is there codependency? Is there some even mental illness in the family system, which will then contribute to this addiction process going on? So even if the spouse isn't, they may have come from this family. Now, you've heard of these situations, sort of a little bit the same, is people who grew up with parents who were from the Holocaust, and the emotional stuff it's very similar, very similar. Some people even look at people with ACOA as people also suffering from PTSD. Some have looked at it that way, and they have actually the same symptoms as PTSD, because being in this family, you're in a war. So they're looking at it that way. You have to assess the family. You have to look at the ages of the family. You have to look at their mental health, because they could be suffering from mental health problems. Unfortunately, in Israel, Al-Anon is very small. In America, I've been trying to get an AA club to open here. Can't do it.
Why?
First of all, there's not enough sheer numbers. That's why, for instance, Marijuana Anonymous didn't make it, because there's just not enough sheer numbers. To open up a club, what they do is they take a storefront and they have meetings literally 24 hours a day, 7 days a week. Well, you don't have those numbers, okay? And it's great in the United States because you've got policemen who work at night, so they go to meetings in the morning. So the problem is sheer numbers, and to some degree you have to get people that are willing to pay the money to donate, not donate, because you can't take outside donation. There's just sheer numbers, it's just not there. I've always said to them that AA and NA in this same situation, if they want to put together a clubhouse, they have to work together, and they haven't been able to do it.
They've got something like that in French Hill. They've got a government thing that's funded, and it's basically for all 12-step meetings. You got AA, SA, Al-Anon, and all that.
Now, and what they also have in America is they have Al-Anon, they have Alateen, and Alatat. So I had families that go in, the husband, again, stereotypical, husband will go into an AA meeting, wife will go into Al-Anon, the kids will go into Al-Anon and Al-Anon. They'd all come out and go to McDonald's afterwards. And that's the best way to do it. But we don't have that here because you don't have the sheer numbers, and it's still, you know, it's going to take a time till it comes here. But the problem also is numbers.
Point of shame also. You don't
People
know about
are
the numbers.
very, very, especially.
Well, but in order to bring Alatot and Alateen and all these, you have to have enough people.
I'm saying they're not going because it's a shame issue also.
Right. Maybe. I don't disagree.
We have a closer
I don't disagree with
society.
you.
And people,
Especially
right, it's very hard to be anonymous.
Jewish, of
You're going to see.
That's the other problem in Israel is the level of anonymous. Everybody knows everybody,
Right.
so it's problematic. I mean, if I go.
We're talking about shidduchim, that's an issue.
Yeah. Well, and part of the problem is when I would go outside, the chance that I would meet a client on the street was almost zero. Here, especially let's say in the Kfar Saba area, there's a good chance I might. So what do I say to them? You know, it's. You're absolutely right. The issue of anonymous is a big problem because the numbers. I mean, in Chicago area, there are 300 meetings a day in the Chicago area. 300.
How many what?
300
Meetings
a day in the Chicago area.
Are the percentages higher?
Even higher in LA.
You're probably
LA,
right.
New York,
New
3,000
York.
meetings
I mean,
a week.
it's unbelievable.
Are the percentages higher there?
What percentage higher of what?
Of people that meet it?
No, in my opinion, I don't see any difference between there and here. You know, proportionally, it's about the same.
It's just there's not as many people.
And it's also been going longer. I mean,
True.
AA started
Also,
at 35.
some people
But
think AA
but
has
NA came here
religious
before AA,
status.
and only came here in the early to middle '60s, and it was brought by some. The story, at least I understood the story, by some actress that came back from America and started the first meetings in the Iriya in Tel Aviv, in the
It's
late
also
60s
drugs
and
are a
70s.
bigger problem because you'll hear it's going to sheker like a goy. I mean, and by nature, Jews were not big drinkers and things, but they they use drugs more. I mean, and a lot more availability to hashish and marijuana in this part of the country, and also distilleries. Everything, all the alcohol had to be imported, pretty much, and we could grow the marijuana here. It grows very nicely.
Sure. So working with the family, you really have to do. You really have.
I've been sober 30 years. I ain't grown marijuana.
So, רק להיום. The point and I strongly recommend to all of you, even if you don't work with addicts, go to an open AA meeting.
Yeah, that's what I did.
You have to go.
I went to an NA meeting.
You have to go to an open AA meeting, open NA meeting.
That's where we met.
You really, it's really important, even if you don't work with addicts.
It's
But because they work with these people.
humbling.
Oh, absolutely.
Humbling. We sit here, go to an open meeting. That you don't say anything. But they'll let you in. It's humbling when you sit there and you hear the people. You'll just be like, okay.
And it should be, listen, open meeting means that the public can come in. So
You
the people that go to the meeting know how much they want to talk because they know the public's there.
Right,
A
the
closed meeting is
you're not allowed in.
you're not allowed
Unless
in.
you're named.
Online,
Unless you're not.
24/7 in case people just want to see what's up.
There's a meeting that I highly
not the
recommend
same.
for all of us to go is for the
But you
ACA
can't
meeting.
always.
Where?
But it's available.
The
so-
ACA meetings, children of alcoholic and dysfunctional families. It's in Hebrew, and I highly recommend it because
I agree.
it's really
Where's that?
Where is it she asked you?
ACA.
Where is it?
ACA. I'll send the information for
Send
the
us a
group.
link, Hagi.
So anyways, I strongly recommend that you go to the meetings to get an understanding of what that is. Because again, you may not treat an addict, but you may treat, if we're looking at the numbers correctly, an adult child or a child.
I also think that when you go to a meeting and you see the people there, they look like there's not anything strange about how they look.
They don't have horns. They
No,
don't.
they are like, they'll come in and they'll say, I just had a business meeting with my partner and he bothered me and I felt like drinking. And you see all these you'll see a lot of successful people who are, this is their minute by minute struggle for some of them, depending.
Doctors also, professionals.
And they're there.
There is in America, I think, 1 or 2 treatment programs specifically designed for physicians, nurses, and so on and so forth.
Talbot
Because they have.
Georgia.
So they have access.
because they have also
I used
access.
I used to speak there.
Right.
They-
So they
don't ever do it if you don't want to hear about your doctor, because I can tell you some crazy stories.
Right, but it is very, it's good for you to realize, like,
Nurses also.
Anybody, you know, how.
Can I just want to say one thing with the
Excuse
codependence.
our
I'm sorry for
time.
things, but I think it's so important. Like, I have a client right now, right? So he comes in, and it's so classic. He's got a drug problem, alcohol, whatever. He's like overweight. His hair things. Like, I walk in, and he's like eating a hummus and things in the chair, sitting there like so disorganized. His wife, makeup, put together, shaved, whatever, right? Just so, right? Overfunctioner, right? Alcoholic father. So, and you'll see this ACOA, like classic overfunctioner, and she's sitting there with a pad, going, "Okay, we're going to get him fixed this time, right?" And I'm telling you, until you start working with her, with the behavior, but you'll see how these things marry. This woman, alcoholic father, crazy thing, and it just, and you'll sometimes miss it because it's like, well, what is this woman doing with this love? Right, and you get that way.
Well, I call it the Nightingale syndrome. A lot of women end up saying, couldn't fix my father, but I'm gonna fix you, you know.
Or, now look at her, she stays with this guy, why does she do it? And there's just a whole thing, but it's very classic. And if you miss it, you'll start going, you know, you'll IP the husband, and or you know, again, and sometimes the wife, you'll IP him and make him the only problem, and it's the cycle again. And you gotta
Also, unfortunately or fortunately, depending on how you use it, if the husband is the addict, the chance the wife will stay is much higher than if it was reversed. Because he has the power, he has the money, she doesn't.
Right, that's
So
often
just
an issue.
we all know this, but again, so it's really important. Now, the timing of bringing in the family and marital stuff is really not easy,
Right.
because if the person is not in their sobriety, not just clean, in their sobriety, they haven't finished the 12 steps, that they're not clean for 3 years, it's very problematic. So it's really important to figure out when to do that, because there's this big SOS problem, like, okay, he's done or she's done, now I expect. It doesn't work that way.
No.
That's why Al-Anon is very important, and Nar-Anon is very important. The term comes from, what happened was, Al-Anon started because Bill W. and Dr. Bob's wives also wanted, and they began this group, used the same 12 steps. There's a wonderful movie, I have it somewhere, that talks about this, about how AA...
They call me Bill W.
That's it. Beautiful movie. Unbelievable. I strongly recommend that you watch it. It's really good. So it's really important.
They call me Bill W.
Yeah, it's with Richard Woods, not Richard Woods, James Woods.
James Wood. No, but you're right. But there's another one that takes it from the perspective of her.
Oh,
That one's a newer one. I forgot it. I will look it up for you and I'll send it to you. I think it was on Netflix one time. Forgot the name right now. So it's really important, when do you do this marital therapy stuff? If we're talking about ACOA people, if you have a husband who's an adult child and a wife who's an adult child, again, you have to look at how this system works and how that addictive stuff that they came with in their families, how that's affecting the dynamics of this relationship. So it's really, really important that you get good information, and they may not tell you information. So you have to be sort of sneaky in how you ask it. So you never say to a person, was your father an addict? No, you say, did your father drink? Okay. How often? 3-4 times a week. Maybe an addict. So you have to be careful how you ask the questions, because they have no frame of reference. A simple side note to this as well. I went to the hospital a couple of years, I had my appendix. Nurse comes in, does a basic, assessment. She didn't ask me whether I have an addiction problem. I have a client, I had a story one time. He went in to get he had an operation. In the middle of the operation, he opens his eyes and starts talking to the surgeon about Maccabi Tel Aviv. Why? Because the anesthesiologist didn't know that this guy was a heavy user. So he gave him a standard amount based on his weight and so on and so forth.
Wow.
I don't know, 10 milligrams, and he needed like 40 milligrams. So then, he wasn't hurting, but in the middle, you got him started talking. And then so they had to shoot him back up again.
Wow.
Continuation of the story, he was out of and he was calling his somebody to bring him drugs while he was in the hospital, while he was recovering. So it's crazy because that's why I'm saying it's not psychological. At some point or other, if you keep making the same mistakes, like eventually at some point you go, I can't do this anymore. But with an addict, because the biological, psychological, and sociological problem, we don't say enough is enough. So it's very problematic. So if you're going to work with the family, you have to make sure you ask all these elements to find out, was there addiction in this family? What level of dysfunctionality was in the family? All the stuff that you already do, but you have to be very specific about that as well to make sure you get that information, because you may not know that if an adult child, if he's got one of these characteristics, if you know that that's a diagnosis, and I hate to use that term, it'll give you an insight as to how to work with them. So if, for instance, he's a Superman, and you confront them right on, that's not good, because they're going to build up a defense.
Yeah, that's right.
Okay? Or if you're talking about an isolate who let's say suffers from depression, you go, oh, come on, you can get out of it. No, it doesn't work that way. So you have to look at the dynamics of all these people, and then you have to determine, the timing, the way you talk to them, or I have a client right now, he has a permanent Mona Lisa smile on his face. And he doesn't even know that he does it. But I have to talk to him about it. So he can begin. I had a client just a day or so ago. He got angry with me. He said, Dan, I'm angry with you because you did A, B, C, D. First time he got angry with me. I said, that's fantastic.
That's a good thing.
Yesterday, because he couldn't get, he's a sex addict. And his father, it's a whole long story. So yesterday, one last story in the relationship to this. He started slowly but surely talking about his father. Did not say he was angry at his father.
Yeah, that's always a problem.
Did not say the word. I said, wait a minute, why didn't you say the word? And what happened was that he's afraid that if he says the word, he's going to get rageful. Because there's so much stuff inside. But he sat there and talked for 10 minutes about his father with this and father. I said, how did it make you feel? And he said, did you feel angry? And his leg got stuck in his throat. It's going to take time. Okay. Shwaya, one step at a time. We'll get to it. But the fact that he told me he was angry opened this up.
Very good.
We need to finish up.
You need to finish.
I need to finish up soon. First of all, we got a chance to review some of this stuff. We got a chance to review the strategies. Your contribution was beautiful. I loved it. I hope we reached our goals, that we brought some enlightenment to this addiction process. For those people who do the addiction all the time, I hope you got new pieces that you didn't know about.
Especially that system of yours.
Yeah, right?
Mom is amazing.
I've used this all the time, and no one can fight me on it. No one can fight me on
a
it.
slide for it.
Beautiful.
That's great.
we don't
That's
have
really
slides.
good.
I don't have a fight for that.
I had a thought that this system that you're talking about it's starting with two alcoholics. But my assumption is that those two alcoholics started from being one of these four people, because imagine a Superman
Yeah,
that
sure.
can't stay a Superman, and the guy who's a criminal, he's not going to be able to handle being a criminal. The isolate, they're going to go to some addiction. All these people end up in addiction.
Statistically, they have a higher potential, but not necessarily.
Wait, no, that's what I think. These alcoholics probably came from their.
Oh, absolutely. Oh, absolutely. Absolutely.
Bill was the Superman and Bob was a little more of the, like...
I didn't think about that. I think you're absolutely right. I didn't think about it from that
AA
perspective.
created what was today Martin.
Let me just finish up. Give me 2 more minutes, and then we can finish up. And if people have questions, we can. First of all, I appreciate the opportunity to speak to you. It was really cool, and it was nice. I really enjoyed being here. I hope you got something out. I hope you enjoyed the process. If you want to call me, please feel free to call me. If you want to continue doing some more stuff together, that's fine. I'm open to that here, or if you have any referrals for me, or I have referrals for you guys, I'm open to it. I enjoy it. I've done it in the past. But really, thank you. And it was really cool to get all of the vibes going, and it was good. I could literally sit here for another half an hour, but I'm not going to do that for you.
What's your phone number? You said
It's 054.
It's on
I
didn't see it.
Be on the page.
Last page.
Oh, okay. Sorry. Okay.
Is there any other questions, impressions?
Where does food fit into food ads?
It's not here.
Well, Overeaters Anonymous, you're familiar with that.
Last page on the
But
back.
food, what the problem with food
Yes, you have to-
is, again, there's a biological function, because usually people who have a food addiction have a higher proportion of carbohydrates because carbohydrates are sugar, and sugar you can become addicted to. Almost as they say, white sugar is almost as bad as heroin.
It fires the same
It
part of the
fires
brain
the
as
same,
cocaine.
as so does fat
So.
and salt.
And what's the problem with food addiction is if it's alcohol, it's like you don't drink, but you can't tell a person not to eat.
Right, that's always the
It's a different.
So that's why dieting.
We want to thank you very,
Dieting
very
doesn't
much
work.
for coming. It was great.
Fantastic.
Everybody found it very
program is
enlightening.
what you- a lot of
And
things
we
you
just
see.
have